How Bhutan got its vaccination plan right and carried out the world's fastest immunization drive. The vast majority of Bhutan's first doses were administered at about 1200 vaccination centers over a week long period in late March and early April. That rate was ahead of those of the United Kingdom and the United States, more than 7 times that of neighboring India and nearly 6 times the global average. Around 1200 vaccination centers inoculating over 64% of the country's adult population with the first shot of a COVID 19 vaccine. This is the secret behind Bhutan's success of controlling the spread of the virus while major countries are seen scrambling to get more shots into arms. Bhutan could have become one of the earliest to start a vaccination drive in the world, but the little Himalayan nation, which was about given 1.5 lakh doses by India in January, chose to hold off the vaccination program started till March 27 as Buddhist monks had advised the government that the time before that was not auspicious to start an inoculation drive. It is used this delay to register all who needed to be vaccinated and planned a drive that would be fast and effective. In late March, it set out one of the world's fastest immunization drive, inoculating a world-beating 64% of Bhutan's adult population with the first dose. As of Friday, April 23, Bhutan, which has always emphasized its citizens' well-being over national prosperity, has administered a first vaccine dose to more than 4,79,000 people, which is equivalent to 64% of its total adult population. Only Seychelles have vaccinated a slightly higher proportion of people at 69%, but it took months to do so. So, what has the Himalayan kingdom done to achieve such numbers? The vast majority of Bhutan's first doses were administered at about 1200 vaccination centers over a week long period in late March and early April. That rate was ahead of those of the United Kingdom and the United States, more than 7 times that of neighbor India and nearly 6 times the global average. Bhutan is also ahead of several others geographically isolated countries with small population including Iceland and the Maldives. Although Bhutan's small population size is a major advantage over many other countries, credit to the extremely successful vaccination campaign must largely be given to the political leaders who understood the importance before things ran out of hand. Jigme Khesar Nagme Wangchuk, the Dragon King, formed the Guardians of Peace, an orange jumpsuited national service corps that has helped to set up staff and more than 1200 vaccination stations across the country. The volunteers delivered vaccine to healthcare centers, ensured citizens reported for appointments, and educated the Bhutanese on government COVID-19 protocols, including social distancing and mask wearing. In areas which were inaccessible by road, authorities even arranged for helicopters to transport the shots. We are really grateful for the vaccine. If not for the helicopter service, we had to travel for more than 5 days to get vaccinated. Dema, a resident of a mountainside village in the northwestern district of Khasa, where around 3,000 Bhutanese reside, told Quincy Online. Moreover, the Prime Minister Loeng Thesing is himself a doctor, and Health Minister Tenching Wangmo holds degree in cardiology and epidemiology from prestigious American universities. As such, quarantine measures in the country have also been strict. In March, the king himself spent a mandatory week in isolation after returning to Thimphu from a tour from southern province, and the Prime Minister locked himself away for 21 days following an official trip to Bangladesh. A low COVID-19 caseload has also helped the country fast-track its inoculation process. Bhutan has recorded only 934 cases and reported just one death, aided by 2 carefully managed lockdowns. It has kept its border closed for over a year now, with few exceptions, and anyone who wishes to enter the country has to go to mandatory quarantine for 21 days. India's contribution in Bhutan's vaccination drive. India has also played a crucial role in rapid rollout of the vaccine in Bhutan. In an effort to counter growing Chinese influence in the region, the country had received 6 lakhs free doses of Covishield vaccine manufactured by Serum Institute of India. Bhutan has also received testing kits, personal protection equipment, N95 masks, and essential medicines like paracetamol from Delhi. History of immunization programs in Bhutan. Health Minister Jiangchung Wangmo created Bhutan's prized possession. It established cold chain vaccination program to the present success. The country had earlier achieved universal immunization in the 1990s and current immunization riding on the existing programs. The health minister has said that there were already a lot of systems in place and it made it very easy to introduce new vaccine through a lot of advocacy and micro level planning. Moreover, already established systems meant people had very little hesitancy in taking the shots. The vaccine outreach also included health workers who had completed the expanded program on immunization, which set the tone for a holistic public health care system in Bhutan and readied a cold chain infrastructure for COVID-19 vaccines. Primary healthcare in Bhutan is free of cost. These healthcare workers were ones who went around the country to administer the vaccines. Thank you.